All right, so clarification on vertebral malformations we talked about yesterday. These refer to these are conformational terms. Okay, so scoliosis is a lateral curving of the spine. Kyphosis is that dorsal curving of the spine. Lordosis is that concave, right? These can be, as we talked about, physiologic. So cats in heat, other animals in heat, for example, they will do this lumbar lordosis to demonstrate receptivity. However, these can also be pathologic. Some of them are congenital. We talked about Hemi vertebrae a lot yesterday in chondrodystrophic dogs. Here you can see a little bit better what that looked like. So these abnormal triangle shaped or block vertebrae are actually fused abnormally shaped vertebrae. This can also be degenerative, so the result of like severe spinal arthritis with deformation of the spine. It's a horse with scoliosis, called the lateral curvature. Alligator with kyphosis, receiving acupuncture. An old horse, this classic lordosis. All right, vertebral malformations. These also come in multiple flavors. Again, they're often congenital. Some are degenerative, but these are most common in dogs and horses. And the flavors this come in is you can have abnormal fusion of otherwise normal vertebral bodies. You can have vertebral bodies like this guy that are monkey shaped. So if you follow the canal through here it's nice and wide, and down here we start to pinch just so it's my body. You can also have abnormal formation of the occiput. You know what that is, right? Back here, occipital area of your skull. Joint laxity and luxations. Here's where degenerative can come into play. If you get severe degenerative spinal disease, you can get laxity of those joints, and it'll cause a dynamic compression. Congenital osteochondrosis lesions can also cause degeneration of the articular facets, leading to joint laxity and compression. Common result of all this is compression of the spinal cord, and that results in degeneration. And two major types of lesions are static and dynamic. So a static lesion would be one like this, where compression is present and to the same extent, no matter what the animal's body is doing. In contrast to a dynamic lesion, where if I'm in a certain position, my spinal canal is the correct width and I'm not compressed. But then if I move a certain way, if I bend my neck, if I flex my neck, then I get compression. I'll show you a couple examples of each of those. But these are clinical differentiations primarily. All right, so FYI, some couple of the most common malformations. Again, it's equines and canines. They both have a syndrome called wobblers. However, they present a little bit clinically. In Dobermans are the poster child for wobblers and canines, and these present with a stenotic, usually a static lesion, whereas horses present usually with a more dynamic compressed lesion. But horses do also have a cervical static, so static version. So these confuse me, and there's lots of them, so I've just listed them. You just see them. Again, these are mostly going to be clinical and imaging. And then one I do want to mention that's very common degenerative change is lumbosacral stenosis. This is seen in old dogs, and again, people, probably the result of old age, degenerative changes, spinal arthritis, and you get narrowing in the lumbosacral area. And this leads to cognitive blindness syndrome, which is that nerve pain down in the limbs, weakness. Oh yeah, so the gait with wobblers between horses and Dobermans is different. Horses often present with this rear limb ataxia. They'll often cross their legs, whereas Dobermans will usually be a wide-based stance. And Dobermans, the classic term is the two-engine gait. Have you guys heard that? So it means that the gait in the front limbs looks like it's propelled by a different engine than the back limbs. So the front limbs are close together. They're taking little short steps. The back limbs are spaced wide apart, and they're taking big steps. So I can't do it. I can't make my legs go slow in my arms. I like this. I hope we're getting this on the Zoom. And go over and dance. 2 engine gait. All right, so here are some presentations of equine wobbler syndrome. This is one of the cervical vertebra, and you can see this bone is severely malformed. There's degeneration here of the articular facet. There's this might actually be an OCD lesion, osteochondrosis, because there is actual defects in the cartilage. But the main point here is look at this spinal canal. This is not the correct shape or width. So would this be a static or a dynamic lesion? Probably. Probably static. Yeah, your bones are. Versus this guy. So here we're right over a joint space. If you follow this cartilage along, is that cartilage gone? We've got some degenerative articular disease. Here should be a disc space, and we've got empty space in there. I'm not quite sure what's going on. And look at the cord right here. Definite compression. So would this be a static or a dynamic? Thinks it's static. Dynamic, probably. Yeah. So these joints are abnormally lax, and they're doing this number. And when you bend, it's when you get pushing of this guy to that guy. You kind of picture that. You can't. Maybe you can picture it with this one. So this is a Doberman with wobblers. This is obviously a dynamic lesion. The neck is actually kind of in flexion for us here. So I have difficulty even following the spinal canal animal, right? So it's here. Here it looks kind of wide. There it's gone. Here, severe compression, especially right here and right here. Look at that. Their no spine is getting through there. So this is a very severe lesion. Okay, and one more. This is the flavor that we see in Cavalier King Charles Spaniels. It's caudal occipital malformation, where you actually have malformation of the back of the skull where it articulates with the first cervical vertebra. This is very similar to a human condition called Chiari syndrome. So we call this Chiari-like. And this is specifically a CPCS lesion. I don't know that we see this really in other animals. But because of this caudal occipital malformation, you get this kind of spectrum of lesions back here that results in coning of the cerebellum, herniation out of this abnormally shaped foramen magnum. You get a often dynamic compressive lesion here in the region of these first couple cervical vertebrae. And the final lesion that goes with this is formation of a syrinx. That's what that is. Dilation and abnormal fluid filling in the spinal cord. So it's like hydrocephalus, but in the cord, hydromyelia, right? So a syrinx is when that is like a focal little bubble. So as you can see here on imaging, there's a fluid. Syrinx. All right, pop quiz. This is from a goat kid. Let's find the lesion and describe it. Multifocal. 2. Red. Raised, depressed, flat.
Raised, what is the breast?
I think kind of raised. Like it looks like there's maybe some stuff filling the sulci here, right? Some red. Some red on you. I also see a little bit of black, right? All right, so what do you think did this? Yeah, trauma. What kind of trauma? A cow?
You said counter coup.
Oh, counter coup. I will give you a hint that this is a bilaterally symmetrical lesion.
Headbutt? You said a headbutt if it's a goat?
A headbutt.
2 horns?
No. Oh, horns. So where are the horns?
What shoe? Oops.
Oh, yeah.
It's burn, your brain burns. And
So
depression.
is that standard or is that
It's not standard.
very bad thing?
This is standard morning. This is bad. They did too much of this for too long and they went totally through the skull and hurt your brain.
Oh my God.
Why?
The normal mistake?
It happens. I mean, these things are very hot. I was actually talking to Mr. Dr. Eames yesterday. He saw me making the slide. He was like, "That's disgusting." It's like, I don't do it. It's the farmers. Yeah. So apparently he if they did this to their goats and he couldn't stomach it more than like once or twice because it smells really bad. But there's like a very short, specific number of seconds, and if you go past that number of seconds, you're into brain burning territory. Yeah, it's very, very nasty.